Cultural sensitivity in healthcare, more than just words. The term culturally competent care has become quite popular lately, but there's a layer beneath that surface, a depth that's more than just about using the right words. It's about understanding each patient as a unique individual. When I first arrived in Chicago, I was browsing a beauty magazine at a Walgreens when a woman asked me if those beauty tips were meant for people like me. I was uncomfortable, not because of her curiosity, but because of the implication that somehow, as an Asian, I was an other. This othering extends into healthcare. I've heard healthcare professionals ask, for people of your culture, what should I be aware of? While well-meaning, this approach misses a mark. It's not about cultural pretexts. It's about engaging with individuals. In my work with Amah Health, we emphasize an approach based on the acid test of behavioral intention. That is, understanding attitudinal beliefs, controllability beliefs, injunctive norms, and descriptive norms. This means understanding what patients think, how in control they feel, what they believe their significant others want them to do, and what they perceive others like them are doing. It's a comprehensive way to respect individuality over assumptions. For example, in my life working as a medical interpreter, I have witnessed many patients hesitant to discuss their beliefs about medicine, fearing judgment. They might say, "We don't believe in Western medicine," or "I would like to mix herbal remedies with my medications." These confessions often happen outside the doctor's room because they feel their individual beliefs are not acknowledged or valued. As health professionals, we must tap into each patient's unique asset profile to encourage an open dialogue and effective communication. Asking open-ended questions and actively listening are key. This is how we transform care experience and improve outcomes, especially for diverse groups. To communicate effectively across cultures, we must go back to the basics. See the person, not the profile. Each patient comes with their own asset, their own reasons and beliefs that influence their health behaviors. For instance, someone might avoid physical activity because they believe it's unimportant. Attitudinal belief. They think it's too expensive or time-consuming. Controllability belief. Their family suggests they should rest instead. Injunctive norm. Or they see their peers living sedentary lifestyles. Descriptive norm. Addressing each of these points through a nuanced conversation can unveil misconceptions and pave the way for change. Health professionals hold a mantle of trust, and with strategic communication, going beyond just being nice, we can leverage this trust to foster better health outcomes. Take the example of my friend, who left her doctor's appointment feeling her health preferences were ignored. The conversation was pleasant, yet they spent most of the time discussing classical music since my friend is a soprano. It wasn't effective in honoring her health choices. Our challenge at Amah Health is to inject the rigor of communication science into healthcare operations, to empower health professionals not merely with the intention to be culturally sensitive, but with the tools to engage every patient meaningfully, respecting their unique asset profile. Because ultimately, it's more than just words. It's about taking actionable, strategic steps to provide care that truly sees and hears the individual.